Good evening. My name is Jonathan Landsman. I am our board chair. This is our general board meeting for May. I'm going to give it another 2 minutes just as a courtesy for those that are connecting remotely. Good evening, everyone. It's May 16th. This is the Oakland Community Health Network, OCHN's general board meeting for the month of May. First item on the agenda is to call the meeting to order. Second is to do the Pledge of Allegiance, so we'll stand and I'll lead that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next on the agenda is to do the roll call. So, Sheila, when you are ready.
Dr. Hans, she's stuck in traffic right now. She's on her way. Dr. Giles, she did notify me that she would not be in attendance. Pastor Jones, he also notified me last week that he wouldn't be able to make it this meeting. Mr. Furman?
Present.
Ms. Woodruff?
Present.
Mr. Torres?
Present.
Mr. Young?
Here.
Ms. Newman?
Present.
Mr. Cowan?
Present.
Ms. May? Ms. Root? Here. Mr. Lansman? Mr. Lansman?
Here.
You have quorum.
We have a quorum. Thank you. Next up is a motion. We're looking for a motion to approve the agenda for this evening. So moved. Thank you, John. Thank you, Melchiah. So there's been a motion made, a second. Is there any discussion or questions? Hearing none, all those in favor say aye.
Aye. Aye.
Any opposed? The motion carries. Next up on the item on our agenda is for community comment, public comment. We do it either audio remotely or in person. Is there anyone that's online remote tonight?
I do not see any public comment online.
Okay, thank you. Anyone in the building that would like to make public comment? All right, there will be a second opportunity to make public comment later on in the meeting. Okay. All right, moving on. Next item on the agenda is Stories That Inspire. And this is related to BEST. Okay, beat stigma. Here we go. All right, Vicki. And with you tonight is Glenda. Okay. How about between the two of you? Does that work?
Good evening. I'm Vicki, the Director of Rights and Advocacy, also the liaison for our BOX work group, and we'll talk about what BOX is in just a minute. And with me I have
Glenda Vidash with Oakland Family Services, Parent Support Partner and Community Liaison.
Glenda is also a member of our BOX work group. BOX stands for Begin Ending Stigma Today, and our mission is to create a stigma-free culture within our organization as well as throughout our provider network. It's not working.
Sure. I'm going to take that.
Right. So our mission for BOSS is create a stigma-free culture here at our own organization as well as throughout our provider network. We have a BOSS work group that's been in existence since 2012. And some of you may have heard this story, but I know we have a lot of new board members. But in 2012, MDHHS, there was a survey done that asked individuals receiving services, where do they experience the most stigma? And unfortunately and surprisingly, the answer was where I get services, meaning in the public mental health system. So MDHHS asked all the CMHs across the state to come up with a plan to address that issue. And for here, us at OCHN, we decided to develop a work group that included our providers, our core providers, and for some time we had some other type of providers involved in that, as well as people with lived experience. So that work group, we meet regularly, and we come up with goals each year on how we want to address issues and to meet the our mission, which is, again, to create a stigma-free culture. One of the goals that we had for fiscal 23 was to create a puzzle piece banner. And in our efforts to do that, each of us that were part of that work group took those of that worked for an agency, took these back to our agency. We had these pieces of puzzles and markers, and we took those back and we asked people to make statements or quotes or draw pictures or use words that help us create that stigma-free culture. And we were able to do that. We've created, if you saw, I had two banners hanging out in the lobby when you walked in. So this is a culmination of puzzle pieces from OCHN, as well as members of our work group and some of our providers. Some of our providers created their own banner, including CHN, TTI, and OFS. And Glenda's going to talk about the creation of their banner.
Okay. Thank you, Vicki. This year was very exciting because society opened up more and people were in the offices and working more in a hybrid. And from the top down and bottom up, everybody participated in one fashion or another. And we did create a banner, and it did create enthusiasm, and it's on display right now in our Pontiac office, which is really our main hub. And I'm going to leave it there as long as possible, and then when I'm asked to take it down, I shall bring it over and give it to Vicki so it can be displayed here. My goal had been to get 50 puzzle pieces, and I did accomplish that. We accomplished that goal, so I was pretty excited about that. Thanks, Vicki.
Right. So it was an opportunity to get all of our members and our employees involved in reminding ourselves about what we need to do to help create a stigma-free culture and then create a really colorful banner as we have on display here. So that was exciting. The work group does have some other goals, but such as some training for individuals that we serve related to self-stigma and some other efforts. Also, we continue to do every couple times a month, we call them stigma wellness tips. We put out an email, a short email talking about some topic or some way that we can all help create a stigma-free culture. And then Glenda's going to talk about what it means to be part of BEST and for her agency to be involved in it.
So I've been on the work group committee for 11 years, and the traction we're gaining this great traction right now, not that we didn't before, but it's so very exciting to be able to incorporate the philosophies of BEST we have our own committee, RISE, Race, Inclusion, Social Justice and Equity, and the values align with one another. And the whole goal is to really eradicate certain words from the English language, to use person first language, to not discriminate, to be a part of, not to exclude, but be fully inclusive. And we're embracing it, and we're embracing it BEST and RISE together. So it's really quite fantastic, and I'm very proud of our agency, and I am proud of the work that we do on the BEST committee. So, thanks.
It is an awesome committee. It has about 20 people, very active, very concerned about making sure we meet our mission. Here at OCHN, I'm always been proud of the fact that when we have new employees come in, they get a BEST training. So because that's really part of our culture here, part of our values. And so as soon as new employees come, some people have not been exposed to a public mental health system at all. I've worked for private agencies. They get to see me, and we do a little training about beginning and ending stigma today. So they understand the value of that for our organization. And we appreciate the opportunity to share with what we're doing and hope that you all will help us create a stigma-free culture.
Thank you both.
Thank you.
Questions or comments? Anyone? I remember when you guys rolled this out back in 2012, and every month we had something at the board meetings, which was pretty cool. Then we've gotten quiet, and then we had DEI, and now we're coming back out again, like second round. It's like the next generation of ending stigma. Maybe we'll get it right this time and no more stigma. That'd be awesome. Thank you guys so much. Again,
Thank you.
more comments? Next on the agenda is the board chair's report. This is my report for May 2023. Our executive committee met on April 27th. We confirmed agendas for this month of May, for last week's Monday, May 8th, Committee of the Whole meeting that covered the Finance Committee's contracts and financial topics, as well as the Policy Management Committee's needs assessment and overcomes report, and along with the transportation update. We also had a closed session, and as a reminder to our board members, discussions covered in our closed sessions are by law confidential, and they are therefore not to be shared with anyone. Just a reminder. It's very sensitive, and by law we could all get into a lot of trouble for discussing what was commented there. We also worked on tonight's agenda, and as well this coming Thursday, next week Thursday's May 25th board study session, which is on the strategic and annual plan updates. And I believe that we have a second topic on there because I don't think we finished DEI, so were we going to try to wrap that one up as well?
Yeah.
Okay, that's what I thought. So definitely worth coming to a week from Thursday. As the board chair and executive committee, we welcome our newest board member, Pastor Douglas Jones, and as part of other business, we'll need to seek assignments for our newest board members to Finance and Policy Management Committee as needed. That may take place. He's not here tonight, so I think we'll have to do that at our next board meeting, which would be in June. Also a reminder to our newer board members, per our board bylaws and policies, please remember to complete your annual and biannual compliance training so that we aren't in any violation of any state laws. The Executive Director Performance Review Committee, the Community 360 surveys were distributed. The results are back. The results were shared with our whole board last week, along with our CEO. Now the board evaluation survey matrix has gone out to our board. So all board members, new or old, we're all expected, all 12 of us, to complete the survey that covers the 10 areas of the evaluation. It is due on or before Monday, May 22nd. I have that date right. So all 12 board members appointed and serving are required to complete this evaluation. I'm only repeating myself because it's important. It's only fair to our CEO if you complete the survey. It's not fair to her if you don't. Following the results, those will be shared with the executive director along with the executive director performance review committee on Friday the 26th of May, once all the results are back. Upcoming is the CMHA, the Community Mental Health Association, has our spring conference Monday through Wednesday, June 5th through 7th up in Traverse City. I think registration's closed at this point, so anyone who is interested in attending, I think you've already made those arrangements with Sheila. Please let us know how it goes. I really am not happy about missing it, but I will not be able to attend. Also, there is still time left to contribute to the Political Action Committee. It's been recommended that one meeting stipend is the amount each board member typically contributes. Please go to cmham.org/public-policy/stipend /CMH-PAC. And in closing, another welcome to Pastor Jones to our board. That concludes my report. Okay. Yes.
I wasn't able to make it to the last meeting. Is there a way I could see the survey results still?
There
Was that
should be a way to
forwardable?
make sure a copy of it is distributed to you
Okay.
and anyone else who was not at the meeting that's a board member. If we can make a note and make sure they get it.
Yeah, it was my understanding that it was sent to the board members that weren't present, so I'll assure,
Okay.
Okay.
through Edna that was sent.
Thank you. I have a second question. I noticed on the board survey that there's a name or a spot to put our names. I don't remember if that's been the practice for the last few years. I was okay with it. I already did mine, but I thought I should question it just in case some board members maybe would prefer not to have their name. So is that a requirement?
Was that on the 360 survey from a couple of weeks ago?
Whenever Edna sent us the board survey
this-
email.
Yeah, the evaluation, correct?
Yeah.
Yeah, it is on there. I thought the same thing, because I don't remember it. The Survey Monkey, it has you, the first thing it has is to place your name on there.
And it's required on there too.
Yeah.
I would prefer that it's not on there just in case someone didn't want to have their name.
I don't remember.
I-
Yes, Sheila.
I think Mr. Hooper spoke with you last week regarding that. He's not on here, but there's a difference between this, to recall your memory maybe, there's a difference between a survey and an evaluation. So this is a 12-member evaluation. I think that's what his point was, but I believe, the determination was to add by you with your comment.
Quite honestly, I don't remember. I know that we would know who it's submitted to.
Edna's online and she has her hand up, so she can speak to this.
Okay, Edna, you have the floor.
Good evening, everyone. The answer to the first question was that, yes, all board members received a packet that included the survey, a PDF copy of the survey, a link to the CEO evaluation via SurveyMonkey, a copy of the reports and analytics, and all of the full comments from the 360 survey. So that was distributed to all board members. So you should be able to see that in your OCHN inbox. As pertains to the question regarding the name, I was advised by Mr. Hooper that he had spoken with the board chair, and I was instructed to make sure that that field was in the CEO evaluation document.
Okay. Well, I do not recall that conversation, and it's maybe just me, but it is a required field. What you choose to put in it, I guess the preferred is that you put your name, but if you're going to put a non-blank in there,
I think I know someone who filled that out once, not for this organization, and they just wrote in board member. I'm not buying or selling that, but I'm just saying it happened.
yeah, it's only for the 12 board members, so. And I've been known to put something other than my name in those things too. And I'm not comfortable with it. Oh, Kaya, do you have you just giving me the look? I don't know. So, thank you. My preference would be to be yourself and choose what you would like to put on there. I know I once failed a test because I put another name on the test, not mine. I think I said Mickey Mouse. But of course, my other questions or my other answers were also faulty, per the teacher.
Thank you. And I did just find the results in the email. I just must not have seen the PDF, but I do have it. Thank you.
You're welcome.
Also, Edna's in the chat. Edna, do you want to state that? Because this was brought up last year at the eval, I believe. Edna, do you want to?
Yeah, so I did receive, some feedback in discussion with the CEO that if that this is a situation where the board is evaluating their only employee. And in the model that we follow with our staff, the board member, excuse me, the supervisor must have an interactive conversation with their staff member so that there can be a shared understanding of what any performance issues or concerns are. So the feedback that I got was if a board member really does have an issue that they would like to see addressed, remediated, or somehow, improved, then that gives Dana a chance to have that engagement as well.
Okay, so on behalf of Dana, I don't mean to talk for you, but I can tell she would very much appreciate it if you put your name on it, so she'd know whose comments came from whom. Okay. Well, I didn't answer mine, and mine doesn't say Daffy Duck. That's it. Okay, but I will put my name on mine. Okay, next up is committee chair reports, policy management. Do you have no report? Okay. Finance committee.
Thank you. Yes, the committee met in the context of the committee of the whole meeting last Monday, and on the agenda this evening for consideration is 3 contracts that were recommended for approval by the committee. Thank you.
Thank you. Next up would be contracts for approval. So let's move to the next page of the agenda, see which one comes up first.
I'm sorry. So the first one was the Crown Castle contract?
It is, okay. So, yes, sir.
I'll move approval of the Crown Castle contract.
Thank you. Is there a second? Second. Thank you. Is there any discussion or questions on that contract?
Question.
Yes, sir.
So this one was an extension then, correct? So this is the Crown Castle we previously used, but now we're extending the contract and increasing services, correct?
That's correct, yes.
That's correct, okay. I just want to make sure I'm thinking of the right one here. So I know we spoke about it at the COW meeting. So, so there was no bid process on this, correct? We just continued with the previous provider that we had, and is that correct?
Yes.
I believe that was
yes.
correct.
The quid pro quo for the extension was the ability to double the performance of the circuit. So that was an important issue, as was stated at the meeting and in the request form that we have for the from staff.
Okay, thank you.
Okay. Are there any other questions? Yes, Desire.
Yeah, well, the summer is almost here, so for every meeting, I'm sure some of the board members won't be able to make it. So on the agenda, when the contracts are described, could there be a brief, a couple of sentences about what it is about? That will be helpful for members that were not able to attend the previous meeting where the full discussion was held. Thank you.
Sure, I can add that, but I also add I include it as an attachment, the board approval form, and it describes the contract.
Thank you.
It's in there as an attachment. Do you want?
I think it's a good idea if we just had a couple summary sentences.
Under each, on the PowerPoints, is that what you're saying?
Yeah.
Okay, yeah, okay.
Because I was looking for the one that I printed off from last week and I didn't.
I can just add the cow PowerPoint that has the whole onto this PowerPoint.
Okay, that's fine.
Would that do? Okay.
Yeah. Okay. Are there any other questions or discussion on the Crown Castle contract? Hearing none, we have a motion, we have a second. Let's do a roll call on it.
Dr. Hans? Mr. Furman?
Yes.
Ms. Woodruff?
Yes.
Mr. Torres? Mr. Young?
Yes.
Ms. Newman?
Yes.
Mr. Cowan?
Yes.
Ms. May?
Yes.
Ms. Root?
Yes.
Mr. Lansman?
Yes.
Motion carries.
Thank you. So this second contract is for Center for Study of Services. I believe this is the other survey company. We use UMSET and we use these folks, or that's the goal, is to use them for additional survey work. And the Finance Committee did vote to recommend this contract. All right. Is there a motion for the approval of this studies services contract?
So moved.
Is there a second?
Second.
Thank you, Vijaya. So there's been a motion, a second. Is there any discussion? Not hearing any, let's move to a vote to approve the motion.
Ms. Root? Ms. May? Mr. Cowan?
Yes.
Ms. Newman? Mr. Young?
Yes.
Mr. Torres? Ms. Woodruff?
Yes.
Mr. Furman?
Yes.
Dr. Hans? Mr. Lansman?
Yes.
Motion carries.
Thank you. And the last item is for the MEI contract, and I just drew a blank on which one that one is.
This is the contract for the repair of one of our elevators that involves some significant work and removal of, I think it's hydraulic oil, and then the controls have to be fixed. So because we do have tenants in the building, I believe we're obligated to have all of our elevators functioning. So I do note that there was a question last time about whether or not this was a budgeted item, and in fact, the sheet's been amended to reflect that it's a budgeted item. So I will move for approval of the MEI contract so we have all of our elevators functioning.
Second. Thank you. So there's a motion, a second. Is there any discussion or questions on the motion? Hearing none, we'll move to a roll call vote.
Ms. Root? Ms. May? Mr. Cowan?
Yes.
Ms. Newman?
Yes.
Mr. Young? Mr. Torres?
Yes.
Ms. Woodruff?
Yes.
Mr. Furman?
Yes.
Dr. Hans? Mr. Lansman?
Yes.
Motion carries.
Thank you. Next up is our consent agenda. It's made up of board meeting minutes from April and minute reports for our RAC, Committee of the Whole, CAC, and as well the Oversight Policy Board. Is there a motion to approve the consent agenda? Thank you, Malkia. Is there a second? Thank you. There's a motion. There's a second. It's a consent agenda, so there's no Q&A. We just move to a roll call vote on it.
Mr. Furman?
Yes.
Ms. Woodruff?
Yes.
Mr. Torres?
Yes.
Mr. Young?
Yes.
Ms. Newman?
Yes.
Mr. Cowan?
Yes.
Dr. Hans? Ms. May? Ms. Root? Mr. Lansman?
Yes.
Motion carries.
Thank you. The consent agenda has been passed. Next up on the agenda is other business. And we have the CEO contract coming up, but part of the CEO contract revolves around the hiring of an attorney. And according to our bylaws that we revised just a few years ago or a year ago, we didn't put anything in there with regard to engaging contractually a law firm or anyone else to do the negotiation on our behalf. So because we don't have anything in there that guides us, I have to seek the board's approval tonight to approve our hiring of a law firm so that we can negotiate in good faith with our CEO and her attorney for her contract extension or new contract. Yes, Sheila.
Can I just clarify? So the
Yes.
approval would be for to task the executive committee to enter into negotiation. And then you guys can bring back the recommendation.
Okay. So does that require clarification? So yes, the board is voting to approve the executive committee to continue the contract negotiations. So our CEO evaluation committee does the year in and year out evaluation, but it's our executive board, unless there's some other board or committee we'd like to form, would be the ones that would guide the negotiation and the recommendation for the new contract. Yes, we need a motion and a second, then we can have a discussion on the motion. Would anyone like to? Thank you. Is there, thank you. So motion of support. Is there discussion? Dr. Hahn?
So the attorney that we are approving to hire, does that represents the executive committee or the whole board?
The committee, okay, so the motion covers three things. One is that the executive committee will take on this task of the new contract. One. Two, it takes on the hiring of the attorney to do the negotiation. But we don't, and the third thing is that the executive committee will make the recommendation to the board on the outcome of the negotiation and where we are with what we should make to go forward. Like finance, makes a motion on support of contracts, policy on policies. This would be for the contract for the CEO. So I don't know if I've answered your question.
In my humble opinion, to answer your question, any attorney that is hired by us, whether it's a subcommittee or a committee, is beholden to the entire board. Doesn't represent just that committee. They may only interface just with that committee until the negotiations are completed, but I believe they would be beholden to all of us and represent us as a board.
So they are representing our executive committee. No, they are representing our general board, all 12 of us.
Right.
As part of OCHN, but not specifically representing OCHN.
Well, that's a good question. I know they'd be representing the board. And we are the operators of OCHN, so we are entitled, so yes. That's right. Right. Because we're working on the contract of our most senior employee, so yes.
Okay.
So the recommendations will be made to the whole board, not just to the executive committee. Yeah. Thank you.
John Paul.
Okay, so as the executive committee then, how would we select the law firm that we're using? Are we gonna go through a process?
It's my understanding that Kalana has identified a law firm. She's been through a few of them, because she's identified one for us. Okay. But we need to do the engagement. She can do that on our behalf, but we need to say, yes, we'll use them, and yes, we want to know how the negotiation is going. Mm-hmm. And once we understand that it's reached its point where both parties are pretty much there, they're providing us with the insight as to what's in the terms and conditions, and we can do more with that or less with that as we need to.
So I guess what's Kalana's role though? Because
only
I know
to
she
find
was,
that attorney.
What's that?
Only to find that attorney.
Okay, because I thought before she was involved in the evaluation process, or I believe, and I think it was the back and forth when we were looking at contractually whether we could change, I think some of the evaluation process. So I guess what would her role be? It would just be to find the law firm or recommend the law firm to us, but not be part of the negotiations?
Correct.
Okay. Yes. And so we have a firm that we hire, and they represent the board, okay? And then does Dana have an attorney? If you choose to use one as well to negotiate on your behalf? Your own private attorney?
Right.
Okay.
And so we would be missioned to, once we've selected that attorney, the executive committee would be missioned to say, attorney, we'd like to have these items baked into the contract.
Mhm.
We'd like these terms and conditions, and let's see what we can do about that. And then the two attorneys, then ours and theirs and hers, would then work together to say, yeah, that works, or how about we tweak it,
Mhm.
whatever.
And as executive committee, then, from that, our product will be to make that recommendation to the entire board, and then the entire board can chime in on anything that they feel pertinent or evident that they would want included in there, but we would still be under the advice of our attorney then, correct, to
As to what's
assist us? Okay.
doable or not, yes.
Right.
So it's not unlike any other contract like we just did for the survey company.
Yeah, and so I'm thinking, like, in terms of, when we did bylaws, we had our bylaws committee, and we came and reported to the board, and then sometimes the board had some changes, they had some things that we talked through and went through, we brought the recommendation, but the board certainly had an opportunity to have their say and to include and move from there. So it'd be the same process in this.
Yeah. If, I'm not a football guy,
Mhm.
but I would look at it this way. It's the attorney's job to get it down to the 1 yard line. It's the executive committee's job to get us to the goal line, and then it's our overall board's responsible to get us over the goal line. How's that? Best I can do for football. Any other questions or comments? Okay, so we have a motion, we have a second. Is there any further discussion?
The timeline, actually, August, correct? Is that,
If not sooner.
okay. But the timeline for when we'll do, so the next meeting that we have with the executive committee, we'll meet, discuss, and we should walk out of there with an attorney, having hired.
Well, we'll have that by then, because I assume we'll vote to say yes here. What I hope by the next committee, because I'll write you guys, is if board members and executive committee have ideas what they'd like to see in the contract, send them to me so we can pass that material on to the attorney.
Okay.
So the sooner we can move that forward, the sooner this gets resolved.
So when we have the next executive committee, then the attorney will be there then, correct? The recommended attorney, or is he, when we go to that meeting, are we talking to the attorney and saying this is what we want so that he can, that person, whoever it is, can start working on the contract?
I will, if we approve tonight, I will ask Kalanda to make sure that they are there for our executive committee meeting, either in person or by phone.
So in this approval is not for the executive committee to hire an attorney, but for who to hire the attorney? Is the executive committee as a whole approving it or hiring this attorney? Because it sounds like they're gonna be hired before the next meeting.
This is authorizing the executive committee to go ahead and hire the attorney, which might be done before we meet,
Okay.
okay? Because there's already been a potential attorney identified from the law firm, and I don't remember which law firm it is.
But then is the entire executive committee voting on the hiring of the attorney, or is it just like you guys?
To provide input into that attorney,
Okay,
and then the outcome from the negotiations,
okay.
okay?
I'm just wondering, because it sounds like we're gonna hire the attorney, and then, and that attorney will be there at the meeting, but isn't the purpose for the executive committee to hire, so we collectively would have to take a vote, correct, to say we're going to hire this attorney for a set amount? I'm just trying, yeah, I'm trying to understand, it's not
Well,
clear.
I guess the issue becomes though, one of timing, because we won't have a contract until the committee meets
Right.
next Thursday, and it's hard to then tell the person to be there. Do we need the attorney at this meeting, at this juncture? I think we might want to talk among ourselves and have issues that we want to be communicated to him or her to address, and then come to a later meeting fully prepared. That would be.
Yeah, 'cause that's what I'm thinking, is that if we're gonna meet, but we're gonna come and this attorney's gonna be there, but we haven't really even met to discuss any of the contract or any of the information. And for that matter, too, we're still going through the evaluation process simultaneously.
But that's through a different committee.
Right.
So I think we can vote it we have a meeting next week, right?
Before the
At 5 o'clock. We can vote on the attorney, inform, that person they've been retained, and then they can come to the next meeting we need him or her for.
Okay. Sounds
Is that
good.
right?
Yep, sounds
Okay.
good.
And I would ask the executive committee and our regular board members, if you have ideas of things that, because we've all had visibility to the existing engagement letter or engagement contract. If there's anything you would like to see in there that you liked or you didn't like, please let us know before Thursday's call so that we could share that. Again, that's next week, Thursday, so before then, so we could share those things amongst ourselves and then with them. Yes, sir.
Do we have access to the existing contract then?
We all should.
I didn't see it on Boardable when I was looking.
I believe it's in a locked file, so it might have been predated your arrival on the board. So, but I can, I'll defer to Mr. Hooper to respond to all this, to have him to,
Every board member should
Yeah,
have access
yeah, I mean,
to it, so.
It's public record, isn't it?
yeah, I can share it.
Yeah.
Yeah, I'll have, Edna share it, or Mr. Hoover share it with the board. But I believe it's in Boardable, it's just in a locked file for those board members that were there during that time. So I'll just make it accessible. And then, so to clarify, on the executive agenda, I'm adding just CEO contract, and do you want anything you want the recommendations for the attorney to be on that agenda?
CEO discussion, is that good enough?
But I just want
Broad.
to have Kalana prepared if you guys want anything at that meeting.
If she's attending the meeting, she can speak to the
Right.
recommendation, and if not, if she can provide something in writing.
Okay.
Okay?
So any other discussion or questions?
So how will we get a copy of the contract? 'Cause I don't think I have it either. I remember seeing it years ago when we,
Yeah, I'll share it right now.
okay, yeah, if, so it's accessible, so we can look over
Yeah,
it.
it's on Boardable. I'll just make it accessible to everybody.
Thank you.
This is in the board. If that makes sense. Not meant to be hidden.
But it is meant to be secure.
Yeah.
Then as soon as you're ready, we'll do a roll call vote on this motion. To empower the executive board committee for the CEO selection, the CEO contract,
Okay.
et cetera, et
So
cetera.
Dr. Hans, I think.
Dennis, could you paraphrase, could you give it a shot at my?
The board is delegating, to the executive committee to retain an attorney, or the executive committee to retain an attorney for the negotiations with, the CEO. And we are also And then, but the negotiations will be with the executive, committee and the CEO. That's the.
And this is on
And
behalf
then,
of...
and then to report back to the board on their recommendations.
And it's, the executive committee is hiring, the attorney on
Yes.
behalf of the whole board.
Of the board, yes, absolutely.
Yes. Yeah, I vote yes.
Mr. Furman? Okay. Ms. Woodruff?
Yes.
Mr. Torres? Mr. Young?
Yes.
Ms. Newman?
Yes.
Mr. Cowan?
Yes.
Ms. May? Ms. Root?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. I appreciate everyone's indulgence with me. I'm not an attorney. Okay, next up, we have our committee reports. First is our RAC, Recipient Rights Committee. Do you have one, Ms. Araya?
The RRAC committee met on May 4th at 4 p.m. The new rights manager, Angie O'Dowd, was introduced to the committee. She brings extensive experience at the state, PIHP, and county levels, and will be a valuable addition to the RRAC. In the continuing series of training, the hospital rights system and our contract with the hospitals that provide psychiatric services was discussed in detail, and this brought out very valuable points in terms of how the RRAC works at the hospital level. But the only point was that we really don't have any leverage in terms of what the corrective actions, if any, they take, except for in cases of suicide in the hospital. The site review reports for April was discussed, and it's 40% complete. The next meeting is on June 1st. Thank you.
Thank you. For the Citizens Advisory Committee, Malkiah?
The CAC met April 19th in a hybrid meeting, the first in-person meeting since the pandemic began. We had a very lively meeting with Officer Casey Crampton and the puppies from the Oakland County Sheriff's K-9 unit. It was a blast. Dana gave her director's report. Christine and Suzanne gave communications report. The next meeting is tomorrow morning at 9:30 on Teams.
Thank you. And I like the puppies too, even though I'm a cat person. Sarah, May, do you have a report from the Oversight Policy Board?
Yep, mine's always much longer since it's quarterly. So, my notes are all out of order. The SUD Oversight Committee met on April 26th here in the offices. You could participate via Zoom too. So we welcomed the new SUD manager, Hillary Ball. She has 10 years experience in Macomb County in the SUD grants, and she's also worked in both inpatient and outpatient for SUD. We had a provider presentation by Alliance of Coalition for Healthy Communities, the ACHC, with Steve Norris, the Director of Harm Reduction. He notified us that they're putting out these Save a Life boxes that are kind of like an old newspaper stand where you can get Narcan, Fentanyl testing strips strategically placed will also be the, the drug known as Trank on the street. I guess they're starting to find that in both Pontiac and Waterford street drugs that are being tested. So they're going to strategically place testing strips for that drug in those Save a Life boxes. They will be accessible. There'll be gloves, Narcan, and all the testing strips in there. And then they'll be accessible 24/7 for anyone in the community. I just received a map of their locations, and they'll be in Madison Heights, Ferndale, Hazel Park, there's 2 in Royal Oak, 8 in West Bloomfield, Orchard Lake, 5 in Pontiac, and 4 in Waterford. And I'm also working with him to find community partners out in my neck of the woods, because obviously my area is woefully lacking in anything like that. And that would be like Highland, Milford, Commerce, White Lake. Along with, they're also working with some of the bars in Ferndale that are just providing free fentanyl testing strips just at the bar. Let's see what else we have. We have the quarterly financial update with interim CFO Patrick Franklin. For legislative advocacy updates, the Chief of Staff Christine Burke presented the board with the plan OCHN has for ending the public health emergency, including plans to do direct mailings in certain communities based on demographics. Christine also presented information about the needs assessment survey and shared with the board the launch of the Youth Family Care Connections program. Communications Director Suzanne Weiner presented some of the upcoming community outreach activities and honored Rabbi Benjamin Greenwald for being awarded the NAMI Faith Leader of the Year Award for his work in the community, his contribution to OPB, as well as at Friendship Circle. SUD Director Megan Phillips, we got to meet her in person. The last meeting she was out because she had COVID, and so this is her second one, and we got to meet her in person. It was really nice. She presented the SUD strategic plan, and it's due to be updated this year. And then Kelly Flynn and Shelley Taub joined the needs assessment work group for that strategic plan. We had an update on jail MAT expansion. The jail MAT program is being expanded to out-of-county individuals under our state opioid response grants, which includes expanding medications like the injectable form of Suboxone, which is Sublocade. It's a once a month injection instead of having to pull an incarcerated person out of their cell or whatever they're doing 3 times a day for medication. Instead, it's just a once a month injection. And we talked about how they're working on getting that available and covered for people within the community outside of the incarcerated community, so that they don't also have to go to MAT 3 times a day. And then we had network adequacy due to the reorganization at MDHS. There's a new requirement that PIHPs provide all levels of care regardless of need across the state. So OCHN will be holding RFPs to contract with the missing care levels, and we're looking to add our own recovery services under the PHP umbrella. We had some updates on National Prevention Week, which was May 7th through the 13th. And we were introduced to the app OPI Rescue or OPI Rescue. MDHS is pushing the app out statewide, and it's aimed to mitigate the opioid epidemic by reducing overdoses and deaths while addressing education, prevention, and tracking of the overdoses. So it'll go through and give you step-by-step how to administer Narcan if needed. You just sign on real quick and get that help, which someone could have used at my bar on Friday because we did have an overdose, and unfortunately, while I left my Narcan there, they were not completely trained. They were able to do it, but it would have really reduce the confusion to have that app available. And then there's still an open board position, and applications are available on the OCHN website. Done.
Thank you. I'm going to take a moment and digress for a second. Listening to you go through this long list reminded me of Dr. Bob Klatz, a longtime board member who used to be on that committee, and he would have the report that would go on and on and on about all these topics covered. I was always amazed just how many things get covered on your oversight committee. So thank you for reporting out.
Mm-hmm.
Next up is our public comment again. All right. Do we have anyone remote? No? Okay.
And defer to Mr. Genove.
So while that discussion's going on, I think we will just move ahead with our public comment for those that are here in the room. So Fred, please come on up. As usual, public comment is for 5 minutes to cover topics. Thank you. We'll send them each side. Topics cover Oakland County community mental health business and advocacy issues only. And at this point, Mr. Cummings, you have the floor for 5 minutes.
Okay. Fred Cummins, President of Alliance for Mentally Ill of Oakland County. Interesting, we started this session talking about stigma. And in case you haven't noticed, stigma is at a peak right now due to mass shootings and other incidents, which are forefront in the news. And one of the things that bothers me is community mental health is nowhere. Don't hear how community mental health is addressing the problem of people who are becoming violent in the community. That's a big problem. Now, what I passed out here is draw your attention to a session that's going to occur in the next CMHA conference, which is effectively a repeat of a session that was held in the last one, having to do with community mental health collaborating with teachers in the schools to intervene with students who are having a problem. That should not be just people who are about to do a shooting. It should be any kid that is having a problem that needs to be addressed. My concern is that when the Oxford shooting happened, the answer of the teachers was, send them home. They knew there was a problem. They didn't think about CMH as any kind of a problem. Nobody does. That's the problem. CMH is not seen as a problem for a way to solve this problem or to address it in any way, because the message is, if you're not ready to do it right now, suicide or murder, then you're out of here. And besides that, you better have Medicaid. It's a negative attitude. That has to change. And part of that change is to get the administration dealing with the fact that community mental health does not have the resources to deal with these problems. That's a big problem. My message here is, you're part of the board association, you are members of that. That is your advocacy group. You need to be using that advocacy group to say, we want to solve this problem. Now, the governor just put forward a budget. Mental health is hardly there at all. No changes. Why? There should be changes. They're putting money into the education system to have mental health workers in the schools. That's the wrong answer. The answer is, What's talked about here is collaboration with community mental health to have the mental health workers come to the school when they're needed. And not only that, when the kid graduates and still has problems or potential problems, he's already engaged. He's not just dumped out of the school and everybody says, well, I guess we're done, until something bad happens. Now, another aspect of this is the greatest sources of stigma in this whole system are the fact that approximately half of the prisoners in jails and prisons across the country are mentally ill. Nobody's helping. And because they're in jail or prison, they have a sentence that ends, and they're back in the community, and nobody wants them. That's the problem. The CMHs ought to be part of providing the services in the jail to intervene in people who are having problems and see they come out of jail better than they went in. Right now they're coming out worse. That problem started when Governor Engler closed all the state hospitals. And effectively, we transferred the population in state hospitals to the jails and prisons. And it's worse than ever. It's not getting any better. And certainly not helping the people that are ending up in jails and prisons. So that needs to end. And part of that is we don't have the resources to take care of people, so we don't provide them very, very good care, and they leave for the streets or elsewhere because we're not providing them what they need, which is more than meds. It's rehab, it's therapy, it's helping their brains, just like you help somebody on PTSD or other mental disabilities. You have rehab. You have substance abuse.
Thank you for your comments.
So that needs to happen. And the other part of it is jails, hospital terms are too long. These are acute care hospitals. They are not there to carry on the services the people need when their acute care is done. We need state hospitals. We need them across the state. These are all budget items that should be addressed. The budget took $9 billion that we had at the beginning of the year and spent it like drunken sailors. And worst of all, we got a temporary tax cut, which we can't survive forever, because in a year or two, we're going to be out of money and we're going to need a new tax cut. And everybody knows you can never get a tax cut, a tax increase. So we cut taxes, now there's going to be screams when it goes back up. So something need to be said by this whole group and all of the CMHs at the next conference. What's going on here? We're squandering the money that we should be spending to fix the mental health system, get it properly funded to deal with the people who need it, which means if we dealt with all the people who need it, it probably ultimately wouldn't cost any more because there'd be fewer people that need as much.
Thank you.
So, thank you.
Thank you for your comments tonight, Mr. Cummins. Is there anyone else wishing to make public comment? Okay, next on our...
if I could just jump in real quick. So just a quick thing about the public comment. We wanted to just put out that any comment that's submitted, we do have 30 days to respond to that. Anything that comes in, we would need sufficient time to prepare a response. Anything that has come in tonight that we're not able to get to will be responded within 30 days by the next board meeting. So just wanted to give a quick update on that.
Thank you. And those are typically handled by our customer service group.
Yes.
Okay. Thank you. Next on the agenda would be our director's report. Yes, Christina.
So we don't have to read the comments that people online are saying they submitted?
No, our policy and practice in the past has been that people make audio public comment, and they are in person making comment.
Just, I got a comment then, or a question. So I did come late to the last meeting, but I think some were read in person and they're anonymous or something, is that correct?
That's correct.
So I'm just wondering, if we did it then, why are we not doing it now?
For the same reason that in years past, we didn't do it before, and I don't know why we started that practice.
I'm just saying we made an
last.
exception.
I don't know why we did, I didn't run
Right,
last.
I'm just saying.
I did not run the committee of the whole meeting.
Yeah, I'm just saying, looking at it from a perspective that we did it last time, and when you open up that door, then you put yourself in a position.
I'm also wondering, so OCHN has 30 days to respond, but the board is not hearing the comment. So how does that work?
So, as I mentioned, we'll read it by the next board meeting
Oh,
with the
okay.
comment and the
It will be
response.
read,
Yeah.
we will hear it.
Correct.
Okay, cool.
Well, as I recall, there are some times where there's a confidential response given back to the board members. So would we actually be reading them, or would we be seeing the comment and the response?
I believe the comment and the response.
So just seeing them.
So we'll see it as a board, but it won't.
We'll see it as a board.
Yeah, it won't be.
Because that's not been our practice in the past.
Okay. I don't have the Open Meetings Act in front of me. This board as a public body has to allow people to speak.
Right.
Not to send in letters, to speak.
Some people
It's a
can't
totally
speak.
different issue if the board as a whole decides every letter that comes into this organization, we want to have read and discussed. And I'm not, and that could be a heavy burden. The meetings themselves are to allow the public opportunities to speak to the board as a whole, and we allow audio, or through audio feature, which many boards don't do. So, you either show up or you send an audio. If you send something in writing, that's in a different category.
What about people who are unable to speak? Whether it's due to anxiety in public speaking or physically unable to speak?
Well, that's a decision the board would have to make. That's not in the Open Meetings Act,
Okay.
as I recall. If it is, I'll stand corrected, but that's my general understanding.
Thank you, Dan.
Yeah. I mean, I've been on other public bodies, and with letters, usually we're given a copy of the letters. That's usually what happens, so, in any response, so.
If I could chime in just for 1 second. Denard Haggins, Corporate Counsel. So in this particular instance, we would need to, read the comment and the answers that are, provided because they were provided in public comment. And we do have 30 days, we have to have 30 days to respond to them. So there will be the opportunity for the comment and the answer to be read at the next public meeting, hoping that the anonymous commenter is present at the meeting and can hear the response.
Who are named here and have a public comment. Are you speaking to that too, or are we only speaking to anonymous ones? Because there's someone who's saying their name.
It's coming on the online form as anonymous, though. Anonymous.
Maybe ask if this person wants to go on audio, because they might.
Anonymous.
They would have the opportunity to join the Teams meeting by audio.
They're on Teams.
They have a name.
And when I asked if there was someone remote, the folks that manage that channel said there were no one. So that's why I moved on to the folks here in the room. And that's been my practice since I became board and before myself. I'm pretty much sure I know what I said. I wanted us to move on because I wasn't sure what was going on, but it was delaying the pace of our meeting. So at this point,
Yeah, I'm just, I think, are we still in the public comment section of the board agenda though? Because if there is somebody who wants to give a public comment, they've indicated that they've named themselves, but it's showing up as anonymous in our format, they should be afforded the opportunity to make the public comment.
So just for clarification, part of what the 30-day response is that in order to read an anonymous response, you need some time to prepare. So when you read the responses in last week, those anonymous responses or comments were submitted about an hour before the meeting. So our team had an opportunity to then provide a response. These responses, these comments were submitted just a few minutes shortly prior to the meeting. None of us were even at our computers. We just continually monitor public comment. So that is why they're not being read tonight, because in order to read the comment, we always, with our public comment, 30 days to respond. The anonymous is what we were referred to do by Bernard last month, because we did have time to review and prepare a response. Tonight's were not something that we had time to even review or respond to. So this board will have this response read, the anonymous comments read, and then it will be accompanied with the response.
But we don't respond immediately to
excuse me,
public
you're not in
comment. But we don't respond immediately to public comment anyways. Like, we didn't respond to Mr. Cummings.
When you have an anonymous comment, what we were told last meeting, you don't have anyone to respond to unless you read it aloud, right?
That makes
sense.
sense.
If you submit something anonymously, I can't respond to you.
Right.
And you can't read a public comment without a response.
Absolutely.
So they go hand in hand. So when an individual gives public comment, right? So just.
Okay. So at this point, I had moved us from public comment because there were no other people in the public wishing to make comment. And so we are now moving to the next item on the agenda, which was I recognized our CEO, Dana, to make her report.
Thank you, and good evening again. I took the liberty of reformatting and refreshing my monthly report just because the data wasn't being analyzed. And I want to do the data analytics probably on a quarterly basis, but really explain to you some of the things that we're doing now that align with our strategic plan, our strategic priorities, and just in general how we're building those relationships with the community. So the first thing I do want to say is May is Mental Health Month, and do we have a series of events and communications that will come out this month, alerting people how to get involved and talk about stigma, anti-stigma, and those other activities that get people engaged in the community. The other thing I have to acknowledge, and I can't really move on without that, is the loss of our health officer from Oakland County Health Department, of Dr. Calandra Green. So the tragic loss of this true partner and advocate for the public health system is major for us. We have developed a strong relationship with the health department and the Oakland County exec through this relationship and those of the team at the Oakland County Health Department, like Leanne Staffer, and now their new executive deputy, Maria Tariq. And actually, they made a point of reaching out to us to let us know, because we do have such a strong relationship and have worked on things like the vaccines, the Medicaid redetermination efforts, as well as Oxford was huge in terms of us coming together to support the Oxford community. So we really need to acknowledge the loss. This is a major loss for us, but we'll continue to work. And we want to look at ways to honor the work that she's been doing or had been doing prior to last week. So with that, I'll move on with my report. I'm glad I got through that. That was very difficult because we did have an amazing relationship. And I'm very proud, honestly, of my team that stepped up. Adam and Christine and all the others got together, our crisis intervention, stress management team, our CISM teams, to actually go to the health department and provide debriefing and support for that team and anybody at Oakland County exec's office that needed that level of support, and just to help get through such tragic information about Dr. Green's death. So thank you for that. The other piece is, in this report, I highlight access and the screenings that we're doing. And then, as I've said before, we're doing continuous quality improvement. So we're looking at ways to make sure that our front door is really accessible. We're extending our hours. We're also looking at our staffing and how we continue to provide ongoing training, making sure that our Access team is well-informed about all the things that we're doing and connecting people to the right services at the right time. So that's ongoing quality improvement. And then the other piece of Access is really looking at making sure that we're tapping into jail diversion, and we're working with the health department, I'm sorry, not the health department, but Oakland County Sheriff's Office to look at ways to do threat assessments with the schools as well as the community at large. So we talk a lot about the crisis intervention trainings and the co-responders. Again, a lot of those partnerships have been strengthened and built upon, and we're seeing more activity because of our relationships we've built in the community. The other thing I did want to highlight in terms of Access, even though it's even bigger than that, this morning we had a core provider meeting, but also an all provider meeting. So we included our core providers, SUD providers, residential, specialized residential, as well as vocational providers. So we had a room of 80 plus this morning. It was a very good meeting. We were able to give updates and reconnect with our providers, some of which we did not or have not seen since prior to the pandemic. So it was a great turnout, a great opportunity, and we are really committed to doing more of that, where we hear directly from our providers about what their needs are, concerns are, but also providing updates to them. Let me see, what else do I want to highlight? Oh, actually, last month, our Chief Clinical Officer and I had an opportunity to go and present before the committee, the Senate Health Policy Committee, in fact, to talk about our new Youth and Family Crisis, or Youth and Family Care Connection, as well as talking about some of the other initiatives that we have with law enforcement and criminal justice. So that was very positive, a lot of good response. And we continue to work with the legislators about clarification about what our role is in the community and how we can expand on those services and supports, including, which is the biggest issue, our workforce crisis that we're dealing with, and making sure that that is truly a part of the budget, but it needs to be a permanent part of the budget. One of the things we know, even with ourselves, if someone says, I'm going to give you $2 an hour extra for the next few months, and all of a sudden that $2 is gone, then what we've built is now weakened again. So we really want to make sure that we're advocating for permanent change so that we don't have to keep going back to advocate for this. We know it's needed. The work that we do, we're very, very dependent upon our vocational and residential providers. We can't do half the things, even our core providers can't do half the things we do without direct care workers. So that's an important thing that we need to acknowledge and continue to advocate for. In terms of crisis services, we're looking at ways to improve the gaps or address the gaps. So the way we see crisis is on a continuum. You're doing prevention, you're doing early intervention, stabilization, and then you're looking at, do people recover from crisis? And the mindset is, yes, people can recover from a crisis, but you have to have all the services aligned so that they're available when and where people need them. And so looking at how we strategically make sure that we are addressing any gaps, having a discussion internally about really setting up regions. I heard Ms. May talk about limited resources in her community. And so by doing this regionally within our county, we're able to look at that county's needs or those areas specifically. So having a crisis center in one area is amazing, right? But in other areas where there's more space and limited resources, you need to have a mobile team who can go to where the problems are. So we're looking at that, and we know we have a difficult time getting providers to commit to providing services in those areas. So just yesterday I was reading an article in Cranes about there's a hospital that's being built with the ED in Oxford community. And so this is a great opportunity for us to reach out now and try to make those connections so that we can provide more mental health services in that area. We know there's a need. We know we have common ground there in the Resiliency Center. We know that Easter Seals is working in the schools. And we also have Honor in that area as well, but it's not enough. So we just need to see where our needs are and try to fill in those gaps as much as possible. Let's see what else. again, the other ideal behind having the meetings like we had this morning is building better relationships with our provider network. And then also the accountability works both ways. We have to be accountable to our providers, but we also have to be accountable or hold them accountable for key performance indicators. Those are things like follow-up after a visit to the ED, follow-up after hospitalization, making sure people are seen in a timely manner, and that there are outcomes connected to that. So you can provide, and I think I said this before, you can provide a service, but if the service doesn't result into a positive outcome, you're just checking a box. The work we do has to improve the lives of people we serve. So I'll end with that. I'm very proud of the team as well for, I heard from this group about initiating job fairs and going to college fairs to recruit. And we actually have been doing that since that was brought to our attention. And we are doing it formally now. And in the last month, we actually attended 2 college-sponsored job fairs. So there's a lot of work being done, and I don't want to bombard you with all the little details, but these are things that take great collaboration and partnership internally, as well as working with our providers that we were with early this morning. So with that, I'll let you see if there's any questions.
Thank you. Any comments or questions for our CEO? All right, next on the agenda would be board comments. Christina, would you like to start? Sarah May? Dr. Hans? Mr. Cohen?
Nope.
Ms. Newman? Mr. Young?
Yeah, Danny, when you said honor health, it kind of reminded me of several things, including our friend that we lost. But in a future study session, can we get an update in terms of our interactions with public health and kind of the whole healthcare continuum? Thanks.
John Paul?
I think we continue that collaboration with community partners, and I think so many different organizations are doing so many things that sometimes people are overlapping services. And I think everybody means well, but I think it's just the collaboration, because we have so many services in the school that I know, being in a school district, on a school board, that are underutilized. And then people need services and they don't know where to go, and it's just those kinds of things. So I think that it's good to hear about the school navigator and the law enforcement, working with them to address threats within the schools. That is a big thing right now, huge. So I'm glad that we're doing that. But the community continuing those collaborations, just because you hear so many different nuances of things that are happening, and sometimes people don't know where to turn because there's just so many options, or they don't know of any of the options because everybody's, overlapping each other. So, but thank you for the report.
Thank you. Yvette?
Thank you for the report. No further comments.
Adam?
Yes, I'd like to thank the staff for time put into the report, and I'd also, thank you. I'd also like to echo what Dana talked about with the fact that the OCHN staff was over at the health department, kind of triaging that grief situation, and that it's wonderful to hear that we were able to step up in such an unfortunate situation. Thanks.
Thank you. And I wanted to reiterate it, not only with the work that we did with the county, but also in coordination with the county last year, about a year ago, when Oxford happened. And we weren't there just because they were Medicaid or not Medicaid. We were there because it was community. And so I think that's the message that's gone across the state, that others should do the same thing. Will make a comment about what Mr. Cummins mentioned here about other districts getting involved with their communities. More of the same kind of thing, because we all recognize its importance. So, thank you. If there's nothing else on the agenda, then I put us into adjournment.